The Brookside Institute in Irvine, California is establishing itself as a pioneer in the treatment of drug and alcohol abuse, using an effective science-based medical program. Institute founder and executive director Keith Owens discusses an innovative treatment plan involving therapy, medications, and brainwave analysis.
Well, we started creating the what we refer to as the Brookside Institute Recovery Protocol about 10 years ago. We started early on with some of the work from the University of Pennsylvania. We started with the work of Dr. Bopicelli and his work with naltrexone, which is an addiction medicine that was created and approved by the FDA strictly for addiction. We also started using cognitive behavioral therapy, again, which was not new but had shown to be the most effective therapeutic treatment out there for addiction and substance abuse. So after several years, we put together the original protocol starting with those two components. We started looking at some work that was done by Dr. Amen, who was doing SPECT scans. And in these SPECT scans, he was showing that there was a part of the brain that would overwork and some that would underwork. And so these dysfunctional aspects of the brain were contributing factors to addiction. So after studying the SPECT scans and some others, we also studied something called the reference EEG. And the reference EEG was a process of analyzing brain waves. And the brain wave analysis would actually show essentially some of the same things that the SPECT scan showed. What this was telling us was here was a dysfunctional part of the brain. Here was a part of the brain that was under or overperforming. So if we had a patient that came in with that kind of a dysfunctional brain, also substance abuse, we call that showing co-occurring disorders, we knew that before we could get him to respond appropriately to the addiction treatment, we needed to stabilize and normalize that brain. And so with the use of the REEG, we were able to identify the medications that would most appropriately work to bring those spikes into a normal space. In other words, we were trying to normalize. Once we normalized the brain, then we were able to work with the addiction issues with a far greater effectiveness. And so that became the Brookside protocol. That was the basis of looking at the patient. As we tell him, we want to pull back the curtain. We want to look to see what the issues are before we start treating.
Here at the Brookside Institute, one of the primary roles that I play is to diagnose co-occurring psychiatric disorders in the substance abuse population that we work with and to treat that appropriately. The whole point of Brookside Institute is for people to have a change in their lives. They obviously wouldn't even be here if they didn't feel like the alcoholism or drug abuse or psychiatric disorder did not impact their lives, and that's really the primary goal, whether they're having problems at work, problems with their family, problems with their friends, inability to socialize appropriately. Those are all the things that we truly are measuring as improved outcome. And so for me personally, I feel very good that we're improving people's lives through the Brookside Institute.
So the Brookside protocol is really one that is science-based medical model and will continue to work on cutting edge. There are a number of new medications in the pipeline now, which we'll be using. There are a number of new techniques, new diagnostic tools coming on, and so we will pursue that alternative as opposed to a 12-step model.